If your contacts are great for distance and you find yourself all of a sudden needing glasses to read up and see up close, understand it's more than likely not a contact lens problem. It is probably just a change in your focusing system or your accommodative system. And so whenever you have glasses on and you can take them off and see up close, well, that works great. That means you're nearsighted. You put the glasses on, you see distance. We put a bifocal with those glasses so you can see up close. What happens with contact lenses is it's really hard to take those out. So we have other options on what we can do. So basically, if you're having problems seeing up close with your contacts on, there are 3 different things we can do. One is we can set up both eyes for distance. You've still got to pick up those over-the-counter readers. Not a big deal, perfectly normal, but that's option 1. Gives you good distance, gives you good up close, uses both eyes at those locations. Option 2 is we can do what's called monovision. We can set up one eye for distance and one eye for up close. So brain learns a seesaw. I'm looking off in the distance, I'm looking up close, and the brain can just shift between the two. Now, monovision isn't a win for everyone. What I see clinically is about a 50 to 60% success rate. So not a slam dunk, but it happens pretty regularly that we can get a success. And so there are different things we can do to check for it. So when we look at you with the phoropter, we can feel out and gauge a little bit if monovision would be a big win for you. Based off your personality, how you're acting, how you're handling things in the exam lane during the testing, that can determine some of that factor as well. And so monovision is a successful option, and we can do that as well. The third thing we could do is multifocal contact lenses. So multifocal contact lenses work kind of like rings on a tree. So when light hits the eye, it gets chopped into different camps, a distance camp and an up close camp. And so the brain just learns which one to seesaw back and forth between the two. Now, it's not all rainbows and unicorns in those, because you will notice a little bit of a haze or a shadow off in the distance and a little bit of a shadow up close. So what I tell my patients is that whenever you're having those shadows, it'll last about 2 or 3 minutes off in the distance the first few days you wear the contacts, and it'll last for about 10, maybe 15 minutes the first 2 or 3 days you wear those contacts. If it's still driving you bonkers after you've worn those contacts for a month or so, you're probably not going to adapt to them. Now, the success rate in multifocal is quite a big range. And the reason that is because someone that's just like a -1, -2, -3, they have a spherical only, no astigmatism. The success rate that I see clinically is about 90–95% of those multifocal contact lenses. It's a pretty high success rate. Now, if you have astigmatism, we can correct that with a multifocal contact lens, and there are multiple options out on the market nowadays for that even. And so we can get that fixed up, but it's going to come with some caveats. And what I mean by that is, if your prescription for glasses is, let's say, a -1, -125 at 90 degrees, that multifocal contact lens pretty much exists in the world. And so if I go grab that contact lens, I would say about an 80% chance of success. But on the flip side, if your glasses prescription is like a -1.25, -1 at 95 degrees, now I've got to make a lot of caveats to get those contact lenses, because I can't buy that exact thing. I can't grab that exact thing. There are a lot of gives and takes that I've got to do. I've got to make a lot of assumptions and make some compromises there. And so that prescription, I would bring it down to probably closer to 60 to 70% success rate. And so understand, if you're having a hard time seeing off or up close with those contacts in, distance looks great, up close is fuzzy. There are 3 different options we can do. All of them are perfectly normal, not a big deal at all. Pretty simple and pretty easy thing for us to do. And so next week I'm going to talk about the difference between an optometrist and ophthalmologist. So if you want to see that video, you might subscribe to the channel and check it out.